Guru Nation, thank you so much for watching. Look, special guest Lee Eifler, panorama guy Evelyn. She's ducking the camera, but Chaim Avaya is gonna be on here soon. But we have like 5-7 minutes before our next patient visit. But we're both this week onboarding new staff, and it's an important topic. It's never been done. Well, I'm not sure if it's been done on my channel before, but you know, there's a spectrum of training at sites. Some don't do any, and some do a lot. Like one of the reasons we started CRC Academy is to train our own staff. So Lana, who's holding the camera, which is my phone today because I didn't bring my real camera, she's day one today, and so we walk her through 3 patient visits. We haven't done a screening, so no consent. And I know you and I have a podcast coming up just on consent. But what is your strategy on onboarding new staff?
I think we have a similar strategy. I think we both take the mentoring role, where we take experienced staff and then put less experienced staff underneath them, and then teach them to mentor, not just from a training standpoint, but from an ethics standpoint, which is important in research, and really develop that talent from somebody that has. I like people that have transferable skills from maybe even another industry.
Like Lana.
Bring them in, put them under more experienced staff, but then build them up with a research background with the skill set that they already have. I also like people that have good references from like you.
I haven't checked any of her references.
The new staff I'm onboarding came with a pretty solid reference.
Desiree, fans of the channel will know. Desiree, they know. She's on many videos here.
Okay, so Desiree's the new staff. Yep. I'm not going to have to do a lot of training there, so it's a huge advantage.
Yeah. And so when you have someone, let's say like Alana, who's brand new, right? My rule of thumb is like 3 months. If you progress well, you should be able to see a visit on your own, like without any overshadowing or supervision from staff. I mean, of course, you'll have like sub bias and things like that, but like to run the visit on your own as a coordinator, it's about 3 months for me.
I think so. I like to get them running a visit on their own earlier than that, but with supervision, because there's little mistakes. Somebody who'd been here for much more than, been with me for much more than 3 months, we had 2 different trials from the same sponsor, but we had 2 master scopes. They looked identical, but they had different protocol numbers on them, and then they did the spirometry and ECG with the wrong equipment.
We're gonna have that.
It went to that. So, and then by the time they identified it, they wouldn't accept it. The patient was out of window. We lost the patient, and that's a big randomization to lose.
Costly mistake.
I do like, I'll go back to like Desiree, who fans of the channel will know. We won't have a lot of time training her because she comes, with a lot of experience. But most of the time, I don't like to hire people with a lot of experience because what I find is that they have a lot of bad experience.
Yeah, me too.
And then also, I'm not going to mention any major medical centers, but on a lot of the big, I'm not going to say there's one in the area. It's a larger institution, but man, I'll have people that have worked there for, I'm doing this for 4 years. Well, what are you doing for 4 years? Well, shipping specialist. All they have done all day long for the last 4 years is pack and ship samples, which can be tough, but that's not the breadth of a skill set.
Yeah,
I need.
That's
like smaller sites. They get a lot.
Assessment, you're sitting there, that's basically one of 30 things to do.
Correct, but that's the only skill. That's the only skill they have, and that's not. And you can't even develop them from that really, because they haven't even dipped their toes into anything else.
And you guys use Creo or eSource?
Yeah, everything's.
How early do you train them? Because Creo has a pretty good tutorial and training course.
We get them on Creo within their first week.
Yeah, Lana's on it already.
Yeah, I mean,
she was already using it today. But do you have them do the self-training thing on there? Or you do not?
It depends. It depends who's training them. Like I said, we have kind of mentor and then under.
I see.
It depends whoever's training them.
Yeah.
So we give whoever's training that person really has the autonomy to train them in which way works best for them. And you got to train different people in different ways.
What about GCP? GCP is day one. Lana's in the middle of doing that now, but like, what about your SOP?
I usually, when we train them on our SOPs, that's what we'll do day one. I make most people do GCP before they start.
Yeah.
If you can't take the initiative to get a GCP done, it's almost like part of the interview.
Yeah, that was my bad for not sending it.
Yeah, if they can't get GCP and AIDA done ahead of time and come in
Yeah.
ready to go,
Yeah.
they're not gonna
That's a
work
good
out.
sign. Like
But do that
Have
with
it.
PIs as well. Now,
Yeah.
not AIDA, but GCP.
GCP at least. Yeah.
If a new PI won't take the time to do GCP, which is literally the first thing you need to do.
And then there are some things you can do from day one, like schedule a patient maybe, or
Yeah,
drop off labs.
There was somebody on one of your one of your posts talking about, well, you say careers wherever, there's none out there. And I told her, I said, go volunteer at a site. I guarantee you there are sites that will let you make phone calls to patients and try scheduling.
Yeah.
You can call and try and recruit. Go volunteer. If you can't get a job in research,
Sites can use volunteers.
it will. Yeah, and they will. They'll let people come work for free, and that's a real recruiting is always something people let you come in and do.
Mm-hmm. Yeah, and that's also like something you can hire for. Like, look for that skill set. Somebody that's detail oriented but also outgoing.
Yeah, and it's a weird inverse of most people in life sciences. It's I mean, we're a more introverted industry. It takes biology in general or life sciences tend to attract people that are more introverted and less extroverted, I think.
Yeah.
So finding that recruitment person, especially the younger generation, they do not like to be on the phone. They do not like to call.
Oh,
they
to actually talk,
like
yeah.
to actually talk. They
They
like
like
to
text.
they like to text, send an email, which is great if you're dealing with younger patients. But when you're doing COPD trials,
Or osteoarthritis.
or osteoarthritis,
Yeah.
or you know, the variety of the internal medicine or ailments are going to be, you know, heart disease or hypertension.
Mm-hmm.
It's going to be older generation. They want phone calls.
Well, good luck, Lee, with your new staff, and you got a good one there in Desiree, and then we'll do our podcast, our long one on ICFs.
Okay.
So thank you very much, everybody.
Thank
Go
you.
follow Lee underneath. His LinkedIn's underneath. Like, subscribe, comment, share. Bye bye.